here today with Bill Hall, the president of Ipsos Healthcare Japan, and also Michael Birt with a dual role today. You're the director of the Center for Sustainable Health at Arizona State University, as well as the CEO of Honeybee Health. Thank you both for being here with us today. We want to start with really knowing a little bit more about each of you. Maybe you could start, Michael. Tell me a little bit about what you do.
Well, as the director for the Center for Sustainable Health, I'm very involved with organizing a network of observational clinical trials that we've launched around how to connect the universe of connected health devices that's just exploding, the numbers, with clinical systems looking to answer clinical questions with those devices. So we've built a kind of bridge between the two worlds, and it's my job to help facilitate that bridge building. And that's my daytime job. My nighttime job is that we've launched a spin-out company from that effort. ASU is a shareholder, and it's called Honeybee Health. And that effort is how to kind of commercialize some of the results and findings of that whole process that we've been involved with.
Bill, tell us what you do.
Well, what Michael was just explaining, it's exploding, but no one has any really good data on how is the average man in the street really think about all this stuff. What does the doctor think about this stuff? And are these two in sync? And which is then how we got ourselves into getting into this research project on the Global Connected Health Survey.
So now your two companies have teamed up to do the survey in connected health. I want to ask, who did you survey and what did you find?
Okay, so we interviewed 5,000 US consumers, 3,000 in UK and 3,000 in Japan, 200 doctors in each of those three countries, and then we built a subsample of 500 diabetes sufferers, type 2 diabetes sufferers in US and 300 in Japan and in UK. So we have a really nice sample in terms of size, in terms of their statistical validity and so on, right? So the data is very reliable data now we have. We had to say, what is connected health, right? Now, because there's mobile health, ubiquitous health, this health, every other health. And if you want to do a survey which is consistent, you need everybody to have a baseline which is the same. So we then explained what is connected health, and we had photographs because it was not just wearables, but it could be ingestibles, implantables, chips and whatever. So that sets the baseline. And so that was consistent across everybody, right? That what we then found is that the US is somewhat more advanced than UK and Japan in terms of the adoptions. Roughly, however, what we saw then in Japan was 20% people said, we don't know what this is. The problem was there is no word in the Japanese language for connected health. So we had to create a word, right? So this is an example of on that side, right? So that's one of the, I think, findings that come out of it. I mean, the second one was, because we did doctor and consumer together, what we have is we took the same questions to both. So you have like a mirror image of the questions. So that meant that when you ask a doctor something and you ask a consumer something, we could compare, is the perception the same or different? And we found quite significant gaps between the average consumer and the doctor.
So you talk about gaps. What's the implication of those gaps?
Well, one implication is that this is really at a fundamental level an education issue, that there's this technology emerging. It's hard for those of us, I've been in this field for 10 years, it's hard for me to keep up. So to expect patient and physician to keep up with this is very difficult. So there's a role for education for the clinician, teaching them how you use this, how it would benefit their patients. There's also a very strong education role for teaching the patient about how to use these well. So I think that may be one of the key findings we found in this study. And it's a very hopeful sign because one of the other findings was looking ahead to 2025, there's very clear global evidence that people just assume that this is going to become part of their lives. So it's just, we have that goal, people see it, it's just how to get there, I think, is the issue, not whether we will or not.
I have to ask, what is the Japanese word for connected health that you created?
This is too complicated to answer, but you know, Japan has 3 writing systems, not one. So we put it first of all in katakana, which is, and it's pronounced connected to health. But not many people understand that, so then we created in parentheses some Chinese characters which had the similar, because they have visual meaning. So because anyone over the age of 50 doesn't understand what connected health is, right? So we had to then put this, so, and almost all the way through we had this problem, yeah. It was a difficult questionnaire to do, yeah.
Interesting.
And Japan's just the first as we do this.
Yeah, as I was saying, you know, what are we going to do in Swahili, and what are you going to do when you talk to Hindi? I mean, these concepts don't exist. So one of the points we made was, you know, the technology is global, the diseases are global, but the uptake is going to be driven by culture and language and localization, right? So that's a very important takeaway as well from the implication side.
So what are the unanswered questions? What didn't we find that we're still looking for answers to?
Well, I can say, I think one is, we saw also between 30 to 50% of people who've tried a connected health device and dropped out. So why are they dropping out? And what can we do to make certain that dropout rate, you know, decreases over time? I think that's one issue which we haven't really got our hands around yet.
And from our side, having done so much work with clinical systems around doing this, is we still have the question of how do we sustain usage by clinical systems and health systems when the economics, the reimbursement systems still don't reward people for doing this yet. We're beginning to see that, but it's kind of making that leap from everyone knows this is good, but we're not paid for it yet, to how do we get this paid for? I think there's some geography there that we have to cross.
So on a very practical level, when we do answer those questions, when we do find a way to get there, what will the impact on patients be?
I think the impact might even be less on the word patient than on people or consumers. Because what these technologies will really provide is a very powerful source of staying healthy, of health rather than disease management. So it has the disease management piece to it, of course. But the real revolution in this will be for society, people, families, health systems to identify early what may become disease so that we intervene and prevent or delay rather than treating type 2 diabetes when you're already, your A1Cs are, you know, through the roof and you're experiencing symptoms. If we could identify that person 10 years earlier, right, the impact on their life is just profound, right? They stay healthy instead of how do you deal with the disease.
And what we then have is, use a Japanese word into the scenario here, is that because we have 25% of the population in Japan now over the age of 65, right? And many of them can see somebody who's a relative who's lying flat in bed, can't get out, or getting dementia or whatever else. So what everyone wants to do is, we say in Japanese, pin pin korori, right? Which means pin means you're healthy and then you just roll over and die. What you don't want to be is lying in bed, and so this will also help us in that scenario to be, you know, healthier longer, right? That's the desire, I think, of everybody. No one wants to be sitting there for 5 years with tubes up your nose, right?
So the specialist in me says, instead of pin pin korori, in English it's the compression of morbidity into the final stage of life. You want to.
That's too technical.
You want to fall off a table at the end.
Yeah.
You were healthy, and then you weren't.
All right, I want to know how I can get the results of the survey. You have a special offer going on.
Yes,
Can you tell me more?
so we will be making this available to HIMSS members at a 60% discount of this price, because this is a big survey, as I mentioned at the beginning, a lot of sample, 40-minute questionnaire across all these countries, and we'll be making that available. And we have you can call into or email into rina.sanga@ipsos.com, and she will be handling all that sort of stuff for us.
Terrific. Bill, Michael, thank you so much for talking
Great.
with us today.